So, like Dr. Muni just introduced, my name is Komal. I work as Director of Medical Education at University Medical and Dental College, the University of Faisalabad. I also serve in different capacities on the board of AMI as well as ASME, as well as a few other organizations. So, today we're going to discuss mainly about grant writing. Grant writing is very important if you want to further your career as a researcher and want to uplift the face of your institution, because it not just benefits an individual, it benefits a whole organization as well as the organization who are giving them the money. So it's basically a three-way traffic, if you may. Regarding my experiences with grant writing, I have written multiple grants and secured many of them. These are some of the examples of the grants that I have secured over the past 4 or 5 years. I've had two grants from the Association for Medical Education, that's AMI. Um, I've been involved in two grants from the Universitas Indonesia. There's a Dolores network of engaged universities in the US. We had one grant from them. And currently, I've just wrapped up my NRPU grant from the Higher Education Commission of Pakistan. And we are also working on a few other projects with the Punjab Higher Education Commission, as well as a patent and a trademark. So the procedure for securing research proposals is similar, but there are some tips and tricks along the way which I thought I should share with everybody. Now, what we're going to do today is we're going to, first of all, define what grant writing is, then deliberate on how to select a grant for yourself, define what your deliverables are, and then finally learn the tips of crafting a proposal. So, as all of you know, a grant writing procedure is basically the practice of filling out an application process to gain financial funding given by governments or trusts or foundations, which helps in leading to research and product progress. So, there are different types of grants. Uh, there can be grants for your study, which are known as scholarship grants. There can be grants for industrial application, which are known as industry academia grants. They can be grants that are given by NGOs for development of certain projects, for concepts. So you have multiple different ways in which grant writing goes. Now, the first thing you have to do before applying for a grant is see that why do you need one? What is the objective of getting a grant for you as the main principal investigator, as the main researcher? So the first thing is, will obtaining the grant aid your studies or aid your career? In Pakistan, in the tenure system for Higher Education Commission, as well as most universities who have set KPIs, winning a grant has a significant number of points that leads to your promotion. So that is one of the incentives over here for grant writing. Grants aid in your studies. For example, if you win a grant as an assistant professor or a professor in engineering or biomedical fields, a lot of those grants result in funding for your master's or PhD students. So yes, grants, they help in facilitating studies of your students. If you are a PhD scholar, they may help in studies for you. Now, the second thing you need to ask yourself is, do I have enough time? A grant is a long-term commitment. It is a writing procedure. It is a performing procedure. So it requires a great amount of effort and time. The grant writing procedure itself requires time, and then fulfilling that grant, whether it's for 2 years or 3 years, it takes a lot of commitment and time. So you have to understand that, is this for you? Do you have that much time or that much capacity? Are you a early career educator? Are you struggling with your career right now? Are you juggling two jobs? Are you a clinician as well as a medical educationist? Are you a practitioner? Do you have young children? So you have to see all of these things before committing to something as heavy as a grant. The third thing which is important is, do you meet the criteria? So whenever you go onto any website or any grant writing procedure, if you ever see a call for the grant, they will always have a criteria in which they will define how much education is needed, what position of the person is needed. So for example, the NRPU There's the National Research Productivity Unit for universities. Are grants given by HEC in Pakistan. They're some of the biggest grants in the country. They have a set education criteria of at least 16 years of education, preferably a PhD, and a full-time position in a university. So if you have all three of those things, only then you can proceed to write a grant in NRPU. Otherwise, you will not be able to fulfill that process. Similarly, AMI has different grants. Some of them ask for you to categorically be a member of AMI, and apart from that, have basic education in medical or dental subjects. There are some grants which don't require the membership, but they have certain years of experience and education needed. So you have to see that are you fulfilling the criteria of the grant. Another very important thing is that is it feasible to finish the application prior to the deadline? So, for example, uh, let's say NRPU launches its project proposal today, and the deadline for finishing the proposal writing is 15 days from now. So, do you have enough material, enough collaborations that you can do it in 15 days? If you can't, it is wise to reconsider another grant or to go for the next one. Because there's another issue in Pakistan, particularly, and I'm sure it also happens in other parts of the world. If you're sending your idea into a place where there are other people who are researchers and academics involved, and you know that because of some reason your application will get dismissed, it's better not to share your individual concepts there, because unfortunately in certain places intellectual property theft still happens. So if your application is not going to be part of the race, don't put it in. Okay, then the last thing is that for every grant there is a catch. So you have to understand who you're applying to. If you're applying to NRPU, what are they focusing on? What is the output they want from you? If you're applying to some engineering council, are they wanting you to make a product by the end? Do they want a machine functional by the end of the grant? So is that achievable in your setup? So before applying, you have to keep all these things in your mind. And then you make up your mind whether you want to apply for this particular grant or that grant, or you want to hold it for now, get more information, and then move ahead. Now, before you move on, you have to understand the general culture of the funder. So, for example, when I apply for, because I basically belong to medical education, I've also worked with optometry, and I have a degree in physiology also. So, some of the grants and research projects I've worked with people are based on optometry and physiology based interventions. Now, when I apply for a grant to an organization that is funding NGOs, for example, we were working on a grant which we later decided not to do because of time constraints on low vision patients in optometry. So, low vision is a problem where you're not completely blind per se, but you do not come into the qualification of being legally visible. Like you cannot read properly, and there's certain things you cannot do. You cannot drive. There is some vision, but it's not adequate to perform daily activities like other people do. So low vision has its own set of issues, but it also has some interventions like mobiles now have voice settings for low vision people. There are glasses for low vision people. There are canes for low vision people. So we were working on a cane development, and we decided to apply for a grant, and we applied to an NGO which was working with LRBT in Lahore. Now, the culture of funding from NGOs is usually that if you are taking money from them for a grant, they will probably be having some sort of a clause or some sort of a hand in the product that you make. So, the product you make will be used by the NGO. Similarly, if you are applying for a grant to a university, either the university will be asking you to be a student there, a PhD grant or a research grant. Otherwise, the university will be asking you to be a collaborator, and the university's name will also be used. Similarly, other organizations like the HEC, the NRPU, the Pakistan Science Foundation, they all have different criteria and different cultures for funding. Most of them require that whatever product is produced from a grant that they give, that product is something which is usable and practical. So it has to be some form of a framework, some form of a equipment, some form of an intervention that can be done in the society. Usually, grants are not granted for theoretical purposes. So you have to be very careful about this. You have to know the culture of the place from where you're getting a grant. When we got the Dolores grant, I spent almost 3 days just looking at the different universities in the Dolores networks, exploring the aims and objectives of the Dolores network. What do they want? How do they want us to work? What is their main purpose? So they're basically a collaborative organization of worldwide universities. And the reason they were offering this grant was because they wanted hub where in Pakistan, where universities from the US could also advertise their work. It was an admissions tactic also, and they could also collaborate and work in less developed areas. So once we found out what they were actually looking for, we tailored the whole grant accordingly. So you have to know the culture of your funder, that what do they want, what is their expectation. The second very important thing is this is very, very important. Follow the instructions. This seems like a very simple thing, but grants are specific scientific documents. So every form is different. The HEC grant performers are very different from the AMI grant performers, which are very different from university based performers. So, whatever instructions are given in your proposal writing performer, you have to follow them exactly to the T. If they're saying 2,500 words, it should be 2,500 words of description. If they want the names and details of all of your team, you have to give all of the names and details along with the ID card number or the passport number, whatever is asked for identification. If they're asking you just specifics of the principal investigator, you will only stick to that. Do not give extra information. So follow the instructions exactly. Do not go above them and do not leave it incomplete. Try to know the assessment criteria. Many organizations do not declare the assessment criteria of grants. There are some who are transparent enough, like the Pakistan Science Foundation, who declare that this is what we are judging the grant on. Many will not. So, what you do is you look at the call for proposal and see what their main objectives are. Try to look at previous grant winners, that what did they do? Yeah, what was the topic of the grant that they got, and you'll get an idea. Once you're done with these things and you're starting the application, you're going to treat your application like an argument where you're trying to convince the other person vehemently that what you are doing is really good. Why is it good? How is it good? What benefit will it have? You have to answer these three questions repeatedly. The last general tip is that use the appropriate disciplinary concepts and methods. So always remember that if, let's say, I'm writing a grant for optometry, I have to know the technical concepts, the disciplinary issues, the technical words, the methodology that is required for my discipline. When I do work with medical education, I make sure that I'm using the exact terminologies that medical educationists use and that are important for them, like pedagogy, curriculum design, learning objectives. So, similarly, in other fields, you have to make sure that it's not a generic general grant you are applying for. It has to be highly specific to your field and your work. Okay, so once you have all these things in mind, like I mentioned before, you have a lot of scope for grant selection. National funding bodies repeatedly keep on sending grants. There's the National Institute of Health. Um, their grant, I think, recently expired in July. It was regarding industry medicine collaboration. The HEC repeatedly sends out grants. Please keep on checking their website. Similarly, for the Punjab Higher Education Commission, they repeatedly keep on sending grants for NRPU, for universities, for other projects. So these are good sources if you are in Pakistan to keep on repeatedly checking. Keep on following the AMI website if you are a medical educationist and you want small grants. AMI is, because it's an NGO, it gives small grants. So be prepared that if you're going for a complex or a larger project, AMI might not be the best place for you. But if you want to do a small grant or you want the name attached, IMI facilitates. Other places where you can look for grants are UNESCO and UNICEF. They have a lot of grants, particularly for nutritional and medical issues. Then there are field specific associations, like if you belong to biochemistry or physiology, your societies will be offering grants, engineering grants, computer science grants. They keep on coming on your specific associations and websites. Certain NGOs will repeatedly be offering grants. For example, Pechan offers research grants in Pakistan. There are a few other NGOs that keep on repeatedly advertising grants. And then finally, of course, you have universities. So if there's a university you're targeting for further studies, if there is a university you want to collaborate with, keep on looking at university websites for offers of grants. Recently, I came across a grant which looked very, very lucrative from Gulf Medical University, which is a collaboratory grant for medical educationists. Um, Unfortunately, we could not apply because we were already overloaded with some work and I already had a commitment on my NRPO grant. But I did share it with a few other colleagues, and I think some of them tried for it. Similarly, Pakistani universities like GIK, uh, they will keep on having grants advertised on their website. Uh, Harvard has grants on its website. So you have to keep on looking at places and keep on visiting if you think that something relevant to you will show up. And always notice the grant criteria, always notice if it is allowed to apply from other nationalities, to apply from resource constraint areas, because sometimes we do all the effort and the work and in the end we find out that we are not eligible. So when selecting a grant, be very careful about this. Okay, now there are two things that you have to look. The first is what you want, which obviously we discussed before also, that it must be clear to you that if you are taking a grant, what is the purpose of it? Is it scholarly activity? Is it showing that you get further studies? Is it establishment of your center or your lab? Any of these things can be the reason. And then the other thing you have to see, which is very important, is what does your funder want? So if you have applied to a particular funder, what is it that is going to be beneficial to that person or that society or that university to give you the grant for? Usually, what we have noticed over the last few years, the trend is grants are now, they're not for theoretical concepts. You have to come out with some concrete invention or intervention, framework, or project that benefits the industry also. So, industrial partnerships are the big equation that almost every funding organization is now working on. So funders will look for what industrial needs are being addressed, because ultimately what will happen is that if they are able to develop a prototype with you, that prototype will then be going into the market as something that they funded. And ultimately, when it works out and it's commercialized, the funding agency gets a lot of kickback on it. So that's why they look into this, that what industrial need is being addressed. What would an improved industrial situation look like? How can your organization work to improve the situation? So now these three things, particularly for those of us who belong to medical fields, we sometimes have this question that how are we going to benefit the industry? So what I've noticed over the past few years and over my experiences with different grants is that the highest need for industrial collaborative participants is with people from backgrounds in medicine, surgery, and allied specialities. Because as doctors, we are usually not trained to work on industrial grounds. And that is why when the industry brings out products that are related to healthcare, they want concrete specialists on board who can facilitate them. So if you have an idea, such as creating an app or a device that will help in diagnosis. For example, we worked on a patent with ophthalmology in which they created a fundus camera from an iPhone. So a fundus camera is actually the ones we use in our hospitals and clinics. It's a huge machine. It's not very mobile, it's big in size, and you have to drag it here and there to look into the fundus of uh, your patients. And looking into the fundus is important for most patients who have advanced diabetes, who have hypertension, because there are fundal changes in them, and it helps in diagnosis and treatment of these diseases. So the Department of Optometry and the Department of Ophthalmology, along with us, we collaborated with our engineering and computer science departments in the university to use a simple iPhone camera lens with another specialized magnified lens to look into the fundus of patients. And the computer science department, along with the calculations given by the ophthalmologists, were able to create an app to actually take pictures of the fundus and notice the size of the fundic changes, notice AV nipping, notice those things. And that app actually works. It used to store data, and it can store the picture, and then the consultant can actually just take a look at it and give the diagnosis. This can be used in the field, this can be used in their office, in their clinic, because it the only thing it involves is a small iPhone with a very small lens attached just to the front of the iPhone. So it became a mobile fundus camera. It was showcased internationally also. uh, they applied for a patent for it, and I'm not sure, we got through the first procedures of the patent, and I think they're at the legal formality level. So basically what clicked with the government in this was that there was an industrial opportunity for it, that it was a healthcare device that was involving the industry. So similarly, whichever field you are in, if you can involve the pharmaceutical industry with you, you can involve the IT industry with you, those things give a lot of traction and a lot of it's very impressive for the funding organizations. So after looking at this, the funding organization will look at other things. For example, because I work in medical education, there's very less scope of industrial, we don't have concrete devices to make in medical education, so there's very less scope of industry partnership in my field. Now for that, you have to look more into what the funders are looking for. What can your organization do to improve a certain situation? How will your project actually show the things that it has achieved? So this is very important. You have to convince them, and you have to show them concrete deliverables. We'll be discussing deliverables in a few minutes in detail, that what you have done, this is the benefit of it, this is how other hospitals can replicate it, or other organizations, other centers, whichever subject you are working in, and this is how we will move further with it. How much will the project cost? This is very important for funders. Obviously, they are basically funding, so the most important thing that they will care about is the money. You have to be very, very honest in this regard. I have experienced with a lot of people and a lot of uh, things happening in organizations, that people think or motivate people to get into grants just so money flows to the organization and they can help in getting other things in their departments, help in establishing a lab. It is not that easy anymore. The process is very transparent. There's auditing at every level. So when you make your budget, it goes through an audit session, and they understand exactly what the real amount of things is. So if you are creating a very ambitious budget thinking that this project will get funded, uh, it will probably get rejected based on the budget alone. Be very realistic about your budget. If you have things which need more money, the organizations that are funding, they all understand that, and they will probably facilitate. But if it's an exaggerated budget, it's going to lead to problems. Another very, very important thing is interdisciplinary work. So if you have a concept or an idea that involves other disciplines, it is much more likely to gain funding as compared to single discipline concepts. So by interdisciplinary, if you can involve different disciplines of your own uh, deanery, for example, medical sciences, if you can involve disciplines from other scholarly projects, like if you can involve computer science, if you can involve pharmacy, if you can involve social sciences, that becomes an even wider scope, and that has a lot more chances of gaining funding. because interdisciplinary work is promoted throughout the world, and it is the only sort of work which gives you practical, applicable things which will work for more than one field. So it's a big yes for a funder that if they find a project which not only benefits, let's say, doctors, but it also benefits software engineers in the making of it. It also benefits uh, programmers, it benefits coders, it benefits social scientists who may have made some sort of a scale for it or some sort of work for it. So that's why interdisciplinary work is considered very, very important if you want good funding. Okay, now moving on towards the main components of a research proposal or a research grant proposal. Like I mentioned before, you have to make sure that you are being very specific according to the performer of the grant that you are applying for. So every grant has a different performer. The titles and topics will vary in each grant. But generally, these are the things that you will have in every one of them. हो सकता है कि किसी का order ऊपर नीचे हो या किसी में नाम change हुए हुए हो. But these are the main things that are present in each grant. So obviously, the first thing is the title. The title is your idea. Try to make the title as accurate and as marketable as possible. Over here, it is a little different as compared to research articles. In articles, we try to make our titles more eye-catching and innovative so that people will read the article. In a grant proposal, you want the title to say exactly what you're doing in the grant. So it has to be professionally written. It has to state exactly what you are proposing, what you want to make. The second thing is going to be the executive summary. This is basically something like an abstract of what your plan is. Then you will have the introduction, which has your literature review in the background. Then you will have your research plan. The research plan is basically methodology of how you're going to make the project, what are going to be the years of the project. You have to have details of different phases of the project. Uh, then we have the timelines, the method of evaluation, that is, how will you see the deliverables, the different facilities you need, the staffing you need, what sort of capacity building you need for this project, the budget, and finally the details of the principal investigator and the co-principal investigator. So briefly, these are all the components. We'll just discuss all of them in a bit of detail कि किस तरह से हर component को लेके चलना होता है. Okay, title मैंने आपको बता दिया कि it's just basically what you're going to do. So any grant that you are taking, the title is going to be exactly what you are making. For example, one of the grants that I've just wrapped up is an Amy grant, and its title is Developing Adaptive Expertise Curriculum for Final Year Clerkships of Optometry Students. So, adaptive expertise is a new type of curricula, and final year optometry is only clerkship based. So, we were developing a proper adaptive expertise curriculum for them. So, that's what we clearly stated in the title. After the title, will have the executive summary. In the executive summary, the first thing is that you have to state the issue at hand. So, whatever the problem is, for example, in this particular grant, final year optometry students did not have enough critical thinking on clinical exposure. They were doing very defined checklists of things, and we wanted that they learn more and they adapt to different patients because every patient does not have the same condition as written in the textbook. So every diabetic patient cannot be looked at in the same way. They have to understand the other things associated with them, the comorbids, the age, everything. So we wanted them to adapt in that way. Then we identified the solution for it, that we develop a curriculum which is based on critical thinking and upon more independence of the learner. So that's where we identified the solution, that we made an adaptive expertise curriculum. Then you come to specifying very briefly in this executive summary your objectives and methodology and what will be your expected benefits of this. So we stated that the methodology of how we will make the curriculum, it was a three-phase project. That first you have to do literature review, you have to create a Delphi to find out the things that experts want in the curriculum. Then you have to make that curriculum, pilot it in a few students, get it approved through the board of governors, and then you have to actually implement it in their logbooks and assess them on it. So there were three stages. Then you have to mention the concrete deliverables. Concrete deliverables basically mean the things you are actually delivering. So learning objectives, specific objectives are separate. Deliverables are physically things that you have to tell your funder that these are the things that are going to come out of my project. So, for example, in this project, the one that I'm talking about, the first concrete deliverable was the design, was the curriculum that was being made. So, it would be a proper document. The second deliverable was the logbooks that we created as a result of that. And the third deliverable would be the assessment and all the execution of the whole curriculum that we had done with final year. So all of their assessments, everything, their scores, how they fared in it, their remarks about it. These were the three deliverables. If you are working in a field which is not social science or medical education based, which has specific equipment that is ready, or things that you can create, or lab work that you can do, so your concrete deliverables will be those. For example, when we were working on the optometry patent, the concrete deliverable, the first one was the blueprint or the design. The second one was the app. The third one was the exact measurements and size of the macroscopic lens. And finally, the last deliverable was actually the whole complete iPhone package. Then in the summary, you will briefly mention the experts you are involving, that you are involving experts from the field of optometry, medical education, and computer sciences, or you are involving them from engineering, anthropology, and biology. So, a very brief mention of how your team will be working. And finally, you will be giving a timeline that I plan to do this project within 2 years, 3 years, 1.5 years, whatever your timeline is. So, this will be like you write an abstract of a research paper. It's going to be a summary of what you plan to do. Then comes your introduction. So, just like introductions that you write in your thesis or in your research, the introduction is basically based on the review of literature. Now, over here, you have to stress on why your work is important. So, the literature you will be reviewing has to be very specific. Uh, it has to be very relevant and very current. Try not to go before 5 years of work, because a lot of grants and a lot of patents, they keep on getting generated throughout. So you will state why your work is important, and you will look at gaps in the review of literature that you can address in this proposal. So you will be finding gaps in the literature that you think are needed for your particular project. Then you come to the objectives of the project. So, like writing objectives of a lesson or of a workshop or of a thesis, your objectives have to be smart. Smart means, most of you probably know this, that they have to be very specific, they have to be measurable in a certain amount of time, they have to be actionable, they have to be relevant, and they have to be time bound. We divide objectives of grants into two terms. They're the immediate and then they're the long term objectives. The immediate objectives are the ones that you will achieve at the end of your project. So, for example, I created a curriculum, I piloted it, one class went through it. These were the immediate objectives that we had. Now, what is in it long term that makes your grant attractive? Will this curriculum be able to be implemented over years in different colleges? Can I disseminate this curriculum in such a way that I can ask the governing body of HEC to work on it? If it is a product, then in the long term, can the hospitals and ophthalmologists in different places use the pocket fundoscope? Can it be given to mobile ambulances? Can other people be trained on it? How can it be used? So all of these things will come in the long term objectives of your project. Okay, so these are the basic parts that we have just done. That is the introduction, the executive summary, and the objectives. Now you move on to the body of the research proposal. So the body of the research proposal will basically be detailing the phases of your research plan. It is advisable to plan in phases because it's easier to implement. आपकी blocking हो जाती है time की, उसको implement करना आसान हो जाता है, उसको लेके चलना थोड़ा सा आसान हो जाता है. तो फॉर एग्जाम्पल आप एक मेरा एक प्रोजेक्ट जो अभी खत्म हुआ है वो ईपीएस की डेवलपमेंट के ऊपर है. So EPAs are interestable professional activities which we develop for clinicians. So it was divided into two phases. The first phase was the data analysis and development of the EPAs, which took almost about 1.5 years. And the second phase was the implementation on house officers, which took about 2 years almost. So we knew very clearly that first phase objectives हमारे 3 हैं, कितने कितने महीने बाद आने हैं और किस तरह से करने हैं, और साथ साथ हम एचईसी को इन्फॉर्म भी करते रहे. सिमिलरली सेकेंड फेज के ऑब्जेक्टिव्स डिफाइन हो गए, वो भी साथ साथ आप यू हैव टू गिव reports to your funding agency that we have done this by now, so that they release funds. First thing, you should divide your project into phases. Second thing, be aware of the shortcomings of the existing and relevant technologies. Mention already that we will try to use these things. However, it is possible that certain technology is not available in my area, or I work in a public sector hospital which is 1500 bedded, so it might not be possible for all of my house officers at one time to actually be engaged with their assessors. So any sort of shortcoming that is coming in your particular project, you have to mention it in detail. Give advantages and disadvantages of the proposed technology, of the proposed technique, of the proposed method, whatever you are doing. And then the last thing is very important. This is discuss the work to be carried out by your collaborators. So a research project is an institutional endeavor. It is not something that an individual does. इंस्टीट्यूशन आपका जो है वो ज़रूरी नहीं है कि कोई यूनिवर्सिटी हो, आपकी अगर क्लिनिक भी है, आपका कोई प्राइवेट सेंटर है, दे आर ऑल considered institutions. But the project can never be done alone. So you will need people with you, and those people are your collaborators. So discuss the work that you are doing, that your institution is doing, and that your collaborating bodies will be doing. For example, in the EPA project, uh, we are collaborating with Professor Oletin Karte, and his work was basically just to vet what we were doing. Then we are collaborating with two hospitals in Faisalabad, where basically Medina Teaching Hospital and one hospital in Lahore. So we're collaborating with them to see if they can implement the APS. So the implementation phase was partly based on the collaborators, and the phase of data analysis, making the plan, and everything was basically on the Department of Medical Education along with clinicians, obviously. So you have to discuss whatever work your collaborator is doing, whether it is small, it is large, it is just consultation. You have to mention it. So research proposal में ये सारा आपका जो main body of your project है, the body of your knowledge that will come in the proposal. Then you give your timeline. It is always preferable to make a Gantt chart. This is a very simple Gantt chart. It shows on the vertical axis are basically you're going to have the names of the different things you are doing. For some reason, they've been cut in the slide. And then horizontally, you can give the months, the weeks, or the years, depending on how you're dividing your project. And then you show that in which months you're doing one thing, where are you doing the other, where are you doing the third, and things can overlap. For example, when you are doing the literature review, you can also start with some sort of write up or some sort of project development. So giving a chart is always, so those of you who are supervising students, you will also agree with this, that it's easy to visualize how your project is going to be carried forward. Make sure that your timeline is as realistic as possible. अगर आपका कोई प्रोडक्ट ऐसा है जो डेवलपमेंट रिक्वायर करता है, जो डाटा एनालिसिस रिक्वायर करता है, तो वो 2 महीने में नहीं हो सकेगा. You have to understand that data analysis, collection, product development, these things take time. So give it flexibility, give it as much time as you think you can easily achieve it. Because one problem is that once you have given a project proposal and your funder has agreed to release that amount of money, you are under contract now. If you delay the timelines, or if in any situation your project is not finished on time, the funder can penalize you They can stop the money to the proposal. They can actually blacklist the university or institution. So you have to be very, very careful about these things, that developing something realistically is more important than developing something amazing. And proposals, organizations, funders, they respect this also. That what you are making is something that you can do and that will improve the quality of life for your patients, or improve the education for your students, or improve your technology. But it's not something which, is so out of this world that it cannot be done in this particular time. If you are looking for more time, then you ask for more time. So don't plan a project that you think takes 3.5 years to be done in 1 year. So be very careful about timing. Then the next thing that you have to be very careful about is your team structure. You have to build a team before you submit your project. Uh, there's a principal investigator, obviously the person who is in charge of the whole project, who is in charge of majority of the proposal, of writing, not only of writing, of executing. The principal investigator has to be an expert in the field. Uh, he has to be somebody who has a significant amount of experience, or if it is not someone who is the senior most, it has to be someone who will be running around the most and doing most of the work, because the principal investigator will be questionable by the funding agency at all levels. So you have to make sure that if you are the PI, you are ready to do that much work. Then there's the co-PI, who will be your second in command, or who will be working with you majorly. After that, you have to develop your team. Do you want a research associate for writing? Do you want a person who is responsible for statistical analysis? Do you want a software developer if you need development of softwares? Do you want your PhD students to be involved? Do you want your postgraduate trainees to be involved? How many and what will be their functions? Are house officers involved in this project? Why are they involved? What are their functions? So all of that has to be chalked out before you are giving this over to an agency. Because a lot of projects have payment slots for these people. So they need to know exactly what the person will be doing and how much we will then be giving them. Now, before we go to the budget, there's something important, that is organizational capacity and contribution. Every funding organization that you will work with will have some clause where they will ask for certain things that your own organization will be providing. So जब आप प्रोजेक्ट लिख रहे हो, इस चीज़ का ध्यान रखिएगा कि जो चीज़ें आपके पास हैं और आपकी ऑर्गेनाइजेशन प्रोवाइड कर सकती है, उनको आप मेंशन करें कि दीज आर थिंग्स व्हिच वी कैन प्रोवाइड. मेजरली मोस्ट फंडिंग प्रोजेक्ट्स नाउ डू नॉट गिव एनी सॉर्ट ऑफ स्टेशनरी. वो कहते हैं कि अपनी प्रिंटिंग, अपनी राइटिंग, अपने सिस्टम्स, ये सब जो है ये ऑर्गेनाइजेशन प्रोवाइड करे. ज़्यादातर में ये है. So you should mention that the organization will provide these facilities. They will provide obviously logistics in the sense of rooms. If it is a medical project, the organization needs to provide the hospital bed, patient care, facilitation setups, nursing. ये सारी चीजें आपके उसमें आ जाती. उसके अलावा ऑर्गेनाइजेशन की कोई पार्टनरशिप्स हैं, कोई सिग्निफिकेंट MOUs हैं जो कि आपके प्रोजेक्ट में यूज हो सकते हैं. So they can be mentioned also. So this gives the funding agency an idea of exactly how much worth your organization has, how much it is serious to invest in you, and then further on how they can facilitate. Now, industrial collaborations, like I mentioned in the beginning, this is the buzzword for all research projects worldwide these days. That how are you collaborating with an industry? Clearly state what benefit would the industry of your country get from this project. So if you think you're making a product, you will want to send it out to the industry, what is the benefit? How will it work? Show the part of work exactly that the industrial partner will carry. If you have a partner who is industrial, वो क्या काम करेंगे, वो किस हद तक काम कर सकते हैं, और इसको आपने लीगल टर्म्स में शो करना है. You're not just writing this in the proposal. You will have a MOU signed and stamped on a stamp paper with that partner before you write the project proposal. And this is important to safeguard any sort of legal communications later on. It is also important to understand that sometimes एज रिसर्चर्स हमारे कॉन्फ्लिक्ट ऑफ इंटरेस्ट नहीं होते हैं, लेकिन एज ऑर्गेनाइजेशंस, एज यूनिवर्सिटीज, एज इंडस्ट्रीज, आपस में लोगों के कॉन्फ्लिक्ट ऑफ इंटरेस्ट होते हैं. सो यू हैव टू सिक्योर योर इंडस्ट्रियल पार्टनरशिप. It's very necessary that you secure your industrial partnership and then write about it. You have to show the collaboration letter from the relevant industry with your proposal. You have to give all evidences that you are working with them. If there's possibility of a patent, try to show some sort of preliminary working. Patents, again, this is very important. Patents are basically original products that we develop. हर फील्ड में पेटेंट नहीं होता. A lot of researchers don't know this, लेकिन बहुत सारी फील्ड्स हैं जो पेटेंट के लिए अप्लाई नहीं कर सकती, इंक्लूडिंग मेडिकल साइंसेस. Unless we develop a specific diagnostic product like an ultrasound machine of new capacity or some other some sort of a fundoscope, some sort, those things can be patented. लेकिन जो हमारे ट्रीटमेंट के तरीके हैं, फॉर एग्जांपल सर्जरीज हैं, या हमारी कोई मेडिसिन की मेथडोलॉजी है, या हमारी बुक्स हैं, या हमारी इवन फार्मास्यूटिकल मेडिसिन हैं, इनके पेटेंट्स नहीं होते. So you have to work around this, that if you are in a field where you can patent something, well and good. If you are not, it doesn't matter. You have to just see the benefits of what you are giving to the industry. So interdisciplinary collaboration gets high weightage always. So jitna bhi possible hai, try to collaborate. I will share an experience that happened in the beginning of this project on EPS that we did. Because I belong to a private institution, private public partnerships are also very valued. So before moving on with the project, I had to discuss with the vice chancellor of our university that we want कि हमारी किसी पब्लिक यूनिवर्सिटी और एक और प्राइवेट यूनिवर्सिटी के साथ कोलैबोरेशन हो जाए, ताकि जब हम इम्प्लीमेंटेशन फेज पे आए, इट इज़ मोर लुक्रेटिव और हमारे पास रिजल्ट ज़्यादा अच्छा होगा और हमें प्रॉब्ली ग्रांट भी बेहतर मिल जाएगा. So we decided to move ahead with it. And what happened was that as a researcher, I was very clear that this is what we're going to do. However, when you go into the hierarchies of different institutions, we got stuck at a certain phase in the middle. So we had to retract that portion और हमें proposal दोबारा लिखना पड़ा without a partnership with another private institution. And this is where you have to understand that आप सारी लीगल वर्किंग पहले से करके रखें. उसमें अगर आपने ज़बानी लिख दिया तो बाद में आपसे आपकी फंडिंग एजेंसी एविडेंस मांगेगी, उस इंस्टीट्यूशन की वर्किंग मांगेगी, उस इंस्टीट्यूशन का रोल मांगेगी. और अगर वो चीज़ें आपके पास ब्लैक एंड वाइट में पहले से डिस्कस्ड और डॉक्यूमेंटेड नहीं है, द अदर इंस्टीट्यूशन may sue you, the funding agency may sue you, or your work just may simply be misused. So always make sure that whenever any other organization is involved during the process of grant writing, use stamp papers, get your administrative body involved and legally implement it. आखिरी चीज जो सबसे important है, the most important thing is the budget. So the budget basically consists of everything that you are asking for spending. उसमें आपकी ह्यूमन रिसोर्स की कॉस्ट आ जाती है कि आप कितनी सैलरी और स्टाइपेंड देना चाहेंगे. अगर आपका कोई ऑफिस बॉय इन्वॉल्व है, आपकी नर्सेज इन्वॉल्व है, आपकी फैकल्टी इन्वॉल्व है, आपका रिसर्च एसोसिएट इन्वॉल्व है, सो दे ऑल विल बी ऑन सैलरीज एंड स्टाइपेंड्स. The research material you are using, if you are using lab equipment, if you are using chemicals, material which is perishable, उसकी एग्जैक्ट आपने किसी सप्लायर से कॉस्ट लेके वो कोट साथ लगाना है और फिर आपने साथ अपनी उसमें मेंशन करना है कि दिस इज द अमाउंट आई नीड, दिस इज द मनी आई नीड. एनी इक्विपमेंट will follow the same procedure. If you are hiring a consultant who you need, uh, for example, some expert in gynecology, somebody who knows software engineering, you want somebody, तो उनके साथ जो आप कॉन्ट्रैक्ट करेंगे, कितनी फी आप उनको दे सकते हैं वो. uh, if your project involves traveling to different areas, to that traveling cost, exactly how much will the ticket cost, how much will be going, you have to mention that. Traveling cost is now discouraged by HEC. उनके grants में पहले होती थी, अब unless and until आप inter provincial traveling कर रहे हैं, traveling cost included नहीं है. Construction cost, most grants do not allow it, but some grants for this is particularly for engineering fields. अगर आप कोई सिविल इंजीनियरिंग का ग्रांट है, कुछ डेवलपमेंट कर रहे हैं, उसमें शायद कुछ ग्रांट्स अब करती हैं, पर जनरली ज़्यादातर ने कंस्ट्रक्शन कॉस्ट निकाल दी है। वो कहती है कि ये चीज़ें इंस्टीट्यूशन के एंड पे होंगी। देन दे आर ओवरहेड एंड इनडायरेक्ट कॉस्ट्स। दीज आर कॉस्ट, फॉर एग्जांपल मैंने कोई रिसोर्स जो हायर की उसकी मैंने ट्रेनिंग करानी है, तो उस वर्कशॉप में जो रिसोर्सेज मेरी यूज़ होंगी उनकी कॉस्ट, उसमें जो खाना होगा उसकी कॉस्ट, उसमें जो सर्टिफिकेट होंगे उसकी कॉस्ट। सिमिलरली मैं अपने लोगों को कहीं भेज रही हूँ ट्रेनिंग के लिए, उस ट्रैवलिंग की कॉस्ट, वहाँ पर उन पे जो रिसोर्सेज यूज़ हो रहे हैं उसकी कॉस्ट। सो दीज ऑल कम इन ओवरहेड एंड इनडायरेक्ट कॉस्ट। सिमिलरली अगर आपको कोई बहुत स्पेसिफिक प्रपोजल है, कोई और आपकी कॉस्टिंग आ रही है, तो वो भी आप इधर मेंशन करेंगे। हाउएवर, मेक श्योर दैट यू आर नॉट ओवर कोटिंग एनीथिंग, बिकॉज द पर्सन हु इज जजिंग योर प्रपोजल इज एन एक्सपर्ट फ्रॉम योर फील्ड। तो जितना आपको पता है उनको भी उतना पता होता है, और क्योंकि उन्होंने पैसे देने हैं, उनको ज़्यादा पता होता है। सो यू हैव टू मेक श्योर कि आप कहीं पे भी एग्जैजरेटेड कॉस्ट नहीं लिख रहे, because everything is audited, and later on when you have when you get the money, तो जहाँ जहाँ आप उसको यूज करते हैं उसका भी ऑडिट होता है। सो यू हैव टू बी वेरी श्योर दैट देर इज नो insincerity coming in the budget. Okay, so that was most about how to write a grant proposal. Some tips once you've written a proposal. uh, get independent reviews, at least एक independent review ले लें from somebody else who is an expert in your field. सो फॉर एग्जाम्पल अगर आपका ग्रांट जो है यूरोलॉजी का है, किसी सीनियर यूरोलॉजिस्ट को भेज दीजिए। अगर कंप्यूटर साइंस का है, किसी को भेज दीजिए, somebody who you can trust, get an independent review from them. Keep refining your draft before sending. Sometimes what happens is that some grants come back from the reviewers with revisions कि अगर आप इस चीज़ को निकाल दें, इस चीज़ को डाल दें, तो फिर हम इसे कंसिडर कर लेंगे। तो do take a look at that, redo the portions that are given revisions. um, don't lose hope if it gets rejected, try again. um, another very important thing is कि अगर आपका let's say grant आ जाता है, before you are availing your grant, please analyze the situation you are currently in. For example, if you win a grant, it is for 2 years, and some sort of commitment or personal investment or something comes up that you know you will not be able to do this in these 2 years. Before accepting the grant, it is better to either defer it or return it back. Because once you get into the grant procedure, you are bound under contract to actually work for that long. We've had a case over here, and I'm sure this happens everywhere because पता नहीं होता कि आपकी क्या commitments हैं. One of our leading scientists was not a medical doctor from another one of our fields. He won a huge grant, and then it was for, I think it was for 3 years, and due to some personal commitments, after the end of the first year, he had to leave the country. So you have to give evidence of where you are, whether you are right, you are still supporting that grant, you are not the PI anymore, you are shifting the principal investigator to someone else in the university. So all of these things, they become legal matters then. So if you know that you are planning not to stay in the organization, if you know that there are commitments coming up which will not give you time allowance, you have to be very clear about this before availing the funds. Last thing is, make the proposal as easy and as presentable as possible. uh, जितनी उसमें सब हेडिंग्स डिटेलिंग, जो भी रिक्वायरमेंट उन्होंने दी हुई है, जितना आसान होगा, जितनी डायग्रामेटिक रिप्रेजेंटेशंस होंगी, सिंपल फ्लो चार्ट्स होंगे, it's easier for people to read and understand. So the more you do it this way, the easier it will be for you. Okay, with that, thank you very much. This was the main presentation. If you have any questions, or we can have a discussion about this now. Any questions anybody has, the floor is open to
Yeah,
discuss.
can I ask a question?
Yes, please.
First of all, thank you so much, Dr. Komal, for such a nice presentation, and really it was informative. One question which I'm thinking about is you told that we have to use the exact specific terminologies, right? But then in the end, you also said that it has to be easily readable, understandable. So I don't know, these two things are quite conflicting with each other. Because if I'll use the exact terminologies, everyone won't be able to understand. So I don't know whether the grant I'm looking for, if they have expert people, to read that and understand that. So that is my question. Should we write in specific terminologies, or it has to be as understandable as possible?
Okay, thank you so much. Thank you for that question. The first thing is that you have to write by understandable and simple. I mean is that don't make it very fancy, don't make it too complicated, don't use very difficult vocabulary and words that make it more into a literary piece. But you have to write specific terminologies. If you're developing a curriculum, you have to write what it is about. If you think that there's some terminology that is relatively new even in your field, then it's best that you define it. But otherwise you have to write in specific terminologies because this is technical work.
All right. Another question, Dr. Komal, is that you said about collaboration, right? Can they be within the same organization where I'm working, or it has to be outsiders?
It can be both. It can
So
be
if
within the
I'm
same.
working in a university and if I'm collaborating with other departments, that is also collaboration, right?
Yes, it is collaboration. However, there are levels of collaboration. So, if you are doing it within your university, that will be considered as collaboration. If you are doing it inter university, that will be considered better. And if you are doing it with interdisciplinary in some other organization, that will be considered even better. So, there will be more points, obviously, if more people are involved. But yes, you can collaborate within your university, and that is also considered a collaboration.
Okay. All right. Okay. And another thing is that, it's a proposal, which means it's a plan.
Yeah.
And you can always, change it. Sometimes there are minor changes, sometimes there are major changes because, time change, technology change. I might think to switch to something else. So how does these, because you said that it's like a contract and you are accountable for it. How does that work if the plan changes? Like I'm thinking to do something else now, maybe in some other way.
Okay, so
How
that
does
all right, that's very important. It works differently for different organizations. Um, for example, if you are asking for a grant from HEC or PHEC, they have yearly reviews. So, sorry, half yearly reviews. So every 6 months, you send them a report and you tell them that this is happening and this is happening. If something is changing, you have to write to them and tell them that due to this particular intervention, I'm changing this part of the proposal. So they usually do facilitate in that. Similarly, if you have a grant from Amy and you think that the intervention has changed or in the middle something has happened, you write to them and you let them know that this is what I'm doing now and I will accommodate the funding accordingly. So probably they will not change your funding because that's a little difficult, but they will accommodate the change that you are asking for. You just have to keep them in the loop throughout. So that's why you have to have very concrete deliverables that you know exactly at which step you are and you keep on updating the funding agency also.
okay? I have one more question. See, sometimes what happens that like if I'm changing the deliverables, how does that work with the grant? Because and another important question is how does these grants actually work? Because I have no experience with it. So do I have to pay and then they will reimburse, or they will give me an amount upfront?
Okay, so first of all, you can't change the major deliverables. Uh, so you have to make sure that your proposal has enough flexibility, that it's not, you're not using something which will become redundant in a few months or so. So you will not be able to change the major objectives or the major deliverables of the proposal. You can change one or two, which incidentally something happens. Um, for example, in the grant for EP is the one I was mentioning. Because of some reasons, our house job got delayed. So it was supposed to be part of the second year report, but it actually lingered a bit later. So I had to write to them beforehand that this is going to happen. The house job will get delayed, so I will not be able to send you the report on time. And then they asked me that how many months delay will there be, and I told them that it is just going to be 2 3 months, so it's going to go into the next year's report, and they were fine with that. So you can, minor tweaking is allowed, but the major concepts of the grant you cannot change once you will get money for it. The way the money works, it's different for different organizations. So once you have received the grant, some organizations give you money upfront. For example, amy gives you all of the money. The immigrants that I've received, they give you the whole amount, and then they ask you to just tell them what you did and where you spent it. The Universitas Indonesia grant, the HEC grant, both of them, they stagger the money. That is, they give it to you in 3 or 4 different uh, sections. So depending on your deliverables, they prepare the budget themselves, and then they will give you the money. They will ask you where you utilized the first installment. They will ask you for evidences. Once you give the evidences, they will give you the second installment. So it works in that way. So it depends on your funding body and on the amount that the grant is. The usually larger amount grants are staggered. You will have them in installments. And no, you don't pay for yourself. They give the money. The only exception is travel grants. In travel grants, they sometimes expect travel grants for specific conferences I'm talking about. If you apply for a travel grant to the HEC that you want to go to a conference, or you apply to some other organization, uh, they usually write to your university that this is the grant, we're going to be releasing the money to you. Kindly give this upfront to your faculty member in case the money does not reach in time for their travel. So that is one option where the money can be taken in advance from university, and university can be reimbursed. But usually otherwise the money comes first, and then you work and you get it audited.
Okay, thank you so much.
No problem. Dr. Sabine has asked in the chat about agencies in medical education. So I mentioned this early on. For medical education, look at, you can actually get a grant from anywhere for medical education because we integrate a lot with a lot of different things. So look at Higher Education Commission of Pakistan, look at the Punjab Higher Education Commission, look at the National Institute of Health Sciences Pakistan projects, but you will have to integrate with somebody from clinical sites for most of these grants. Um, Purely medical education grants are receivable through Association for Medical Education in Europe, that is AMI. There is Association for Study of Medical Education, that is ASME. Some universities like Maastricht keeps on offering grants from time to time. GMU keeps on offering grants from time to time, so you can keep a lookout on their websites also. So, any questions from anybody else, please?
So I believe you've answered all of the questions, Dr. Komal, and the participants are thanking you in the chat. So thank you so much for the wonderful presentation, and thank you so much for sharing these valuable insights. And with this, we'll be closing the session for today. All of the participants are going to receive the recording for the session today, and they will be receiving their certificates of participation soon afterwards. With this, thank you again, Dr. Komal. Thank you, all of the participants. Dr. Komal, if you'd like to say some final words before we conclude, you're welcome.
Thank you so much, everyone. Thank you for being such a wonderful audience. And I hope that it was somewhat helpful to all of you. And you can always reach out through Education Unlimited, or if you have my WhatsApp number or my email address is komal.atta@tuf.edu.pk. So you're always welcome to ask or reach out at any time. Thank you so much.
Thank you again, Dr. Komal. Thank you for being so gracious. With this, we'll be closing the session. Thank you, everyone. Allah Hafiz.
Allah Hafiz.
Allah Hafiz.